Thiện, now 7, made national headlines when he was found abandoned 3 days after his birth in a mountainous region of Quảng Nam province in central Vietnam. Wild animals had devoured his genitals and his right leg. His adoptive mother, Mai Anh, took the boy to major hospitals in Thailand, Singapore, and the US, but leading doctors said they could not recreate a penis for Thiện because it was a procedure they had never performed before. But luck finally smiled on him. In Italy, Dr. Roberto De Castro from the Bologna Hospital had publicized his research into recreating penises for patients in cases similar to that of Thiện. American doctors informed Mai Anh and introduced her to the Italian doctor. Mai Anh and Greg Kraft, president of Asian Injury Prevention or AIP, and godfather of Thiện, sought to bring Thiện to Italy to see Dr. Roberto De Castro. 4 operations later, Thiện is now a real boy. The miracle has been repeated since the Thiện Journey program kicked off to help hundreds of other children in Vietnam also suffering from genital losses or defects.
Hello and welcome to Talk Vietnam. Many Vietnamese have at least once heard the story of Thiện, who is now dubbed the Brave Tin Soldier, and his journey to returning to a normal life. Behind this miracle stands his family, who had great care and support for him, as well as a talented Italian doctor. It's our honor today to welcome Dr. Roberto De Castro in our studio. Hi, Dr. De Castro. Thank you for coming on the show today. How are you?
Thank you. I'm fine, thank you.
Let's go back to the very beginning. Can you tell me what made you decide to help Thiện, and how did you do it?
They came to me. I had the opportunity in August 2010 to see him for the first time. Oh, it's such an extraordinary boy. Really such a nice, very intelligent, very smart. And I had the opportunity to meet the mother, the adopted mother, and May Ann, a wonderful lady, and the Mr. Kraft and Mrs. Kraft that support the organization. And they asked me if there was any chance to do my phalloplastic for Thiện. Thiện had a special story because he was not a congenital. He was born perfectly normal. And then he had the story, the trauma, and he lost the penis. In this particularly traumatic aphalia, we call traumatic aphalia, traumatic absence of the penis, behind the scar, behind the situation that you find at the place of the genitalia, deep inside, sometimes it's possible to find some residual corpora cavernosa. That is something that in the congenital absence of the penis is never present. So this is something that could be very important. And actually Thiện had enough amount of corpora cavernosa inside, and we made the penis around this corpora with the idea to have a penis that could function, could have erection, could have sensation. And this was the first operation. So we decided to do the operation, and the first operation was done in Italy. And this was in the end of January, winter time. It was snowing in Bologna. And Thiện was looking at the window because this snow was not so common for him. He was not familiar with the snow. And so we did the operation, and we were happy about the immediate outcome. But unfortunately, we realized after some days there was some problem. The penis we made was not very well vascularized, and then some infection came. And this made, unfortunately, our operation not completely successful. I can say maybe an unsuccessful one. And this was one of the most important reasons, because I was really ready to come, because my first goal was to come back and see him and see if I have the possibility to, to do something again for him. Family was so nice to accept such a difficult situation. And Thiện himself, he would say, well, don't worry, Roberto is coming to fix me again. So he was, so nice to still to have the hope for the good future. And so
Very strong will.
so we came, we did the two operation in preparation of the big moment when we do the redo operation. It was about 5 hours surgery, and but luckily we were able again to find this residual corpora and able again to make the penis. And apparently this time we don't have any trouble and no infection. So I hope to finally to have reached a very good result.
I hope so too.
June 2012 was the third time Dr. Roberto de Castro operated on Thiet Nhân, following the first procedure at the Bologna hospital where he works. This time, his co-surgeon was Vietnamese-American Dr. Tuệ Dinh, a plastic surgeon from Houston, Texas. It was Dr. Tuệ Dinh who introduced Thiet Nhân Family to Dr. de Castro's technique of phalloplasty.
The ultimate goal is to create a phallus, a penis, and that is our ultimate goal. And a functional penis is working that he's going to be able to urinate to the end of penis. Now, this is pretty complicated, so I think today we are going to see if the flap, which is a piece of tissue that we put tissue expander last year to expand, whether the flap is going to be viable. The blood supply should be enough, but we're not sure. We're going to check on that.
Doctors from the surgical department at the National Pediatrics Hospital gained valuable experience from assisting Dr. de Castro, one of the top urologists in the world, during surgery.
Giáo sư này de Castro cũng là người mà sáng tạo ra cái phương pháp mà tạo hình tái tạo lại cái con sinh dục nam cho các cháu mà bị mất một phần hoặc mất hoàn toàn. Thì đây là một kỹ thuật mới không chỉ ở Việt Nam mà của cả thế giới nữa. Thì do vậy mà khi ông ấy thực hiện các cái kỹ thuật này ở đây, chúng tôi có thể học tập và có thể thực hiện được cho những cháu về sau này. Nếu về nói về mặt hình thức, hình thái của cái bộ phận sinh dục của nam mà để tái tạo thì chúng tôi thấy là rất là tuyệt vời. Vì nó có hình thức và hình thái và bên ngoài ấy thì có thể nói là như thật. Còn chức năng thì mình còn đánh về lâu về dài, sau này khi các cháu nó lớn, nó phát triển rồi. Có thể đến lúc mà khi có thể các cháu nó lớn đến tuổi trưởng thành, dậy thì và có thể đến lúc mà lập gia đình, lúc ấy mình mới có thể đánh giá được tất cả các chức năng.
Bùi Kim Anh, the mother of Mai Anh, had eagerly anticipated meeting the doctor more than most. She has been by her daughter's side since Thiet Nhân became part of the family. Now, she is Mai Anh's right hand when it comes to handling medical files.
Tôi đã chứng kiến có những cháu mà nó 30 mấy tuổi con trai hoặc 20 mấy tuổi con gái. Khi mà nó biết tin nó đến bệnh viện, nó gặp mà nó chỉ mong một điều, tức là bà cho cháu vào. Cháu chịu đựng 30 mấy năm rồi. Cháu muốn được yêu, cháu muốn được lấy vợ. Đấy. Tức là xã hội chưa hình dung hết cái nỗi đau ấy. Hoặc có những cháu bé là đến tuổi đi học không dám đến trường. Bởi vì các bạn lại bảo là cái thằng không chim rồi hoặc là kéo nhau tụt quần chẳng hạn.
Thiet Nhân health was unable to stand up to 10 hours of surgery, so the doctors were only able to reconstruct his testicles and the cosmetic appearance. Other tasks, like inserting the urethra inside the penis, were completed in another procedure 5 months later. The operations have helped Thiet Nhân realize his dream of going to school like every other kid. He is now in 2nd grade at a primary school in Hanoi.
Can you tell me what was the most challenging part in the surgeries that you've conducted for Thiet Nhân so far?
To find enough skin, enough tissue to make a penis. And to do that, we had to have some extra skin available. The normal abdominal wall is not enough for to give us all the skin we need. So to do that, we had to insert behind the abdominal wall, behind the skin, between the skin and the muscle, we had to insert some special device that we call skin expander.
Wow.
And then you have to feel like a balloon, and slowly, week after week and months after months, you have some extra skin that is coming. At that point, when you remove the skin expander, you have
Extra skin.
extra skin available. So to do that, we had to do 2 operations, and so finally we reached the amount of skin, a good amount of skin to possibility to do the surgery again.
That's excellent. What can you say about the prospects for Thiện Nhân after his 4th surgery?
Thiện Nhân had not only a cosmetical reconstruction of the penis, but also a functional reconstruction. And of course, he will need some more treatment by the pediatric endocrinologist, and the future by the general endocrinologist. But he can have a normal sexual life.
That's really
That's
amazing,
very important.
And now, after all those years, who is Thiện Nhân to you right now?
Oh, I love him. I love him very much. I don't know if he likes me still. But immediately after surgery, he's a little bit, not so happy to see me because I have to do some little dressing, some little change. But I hope that he will, again, I will reach his confidence very soon.
On her journey to find a way for her son to become a real boy, Mai Anh, Thiện Nhân adopted mother, found a way to bring happiness to other people suffering under similar circumstances. She joined forces with Greg Kraft, president of the Asia Injury Prevention Foundation, who became the boy's godfather. Let's take a look.
Chen Mai Anh, Thiện Nhân adopted mother, and Greg Kraft, his godfather, decided to launch the Genital Reconstruction for Children program, commonly known as the Thiện Nhân Journey, in August 2011, following an unforgettable incident.
Nó khởi nguồn cũng là động lực từ việc tôi nhận được một cuộc điện thoại của một người mẹ lúc đấy đang cấp cứu cho con ở trong viện bỏng. Cháu bị bỏng, giật điện cao thế. Khi cầm một cái quai inox để kêu cái diều bị tuột dây thì nó đã giật và làm bay mất 2 tay của thằng bé và cháy toàn bộ khu vực người. Vì lúc đấy mặc quần có cái kéo khóa kim loại thì cháy toàn bộ bộ phận sinh dục của người. Thì khi lúc đấy con đang nằm trong viện bỏng thì mẹ cháu có gọi điện cho tôi và nói là chị khóc và nói là con em đang bị như vậy. Mọi người vào thăm thì khuyên em là hãy gọi điện cho các nhà báo vào thăm cháu, thì có khuyên là hãy gọi điện cho chị Mai Anh, mẹ cháu Thiện Nhân. Thì em gọi cho chị, em cũng biết là có thể không làm được gì cho cháu, nhưng đến một ngày nào đấy chị làm được gì thì chị hãy nhớ đến mẹ con em.
Since then, the program has examined nearly 1,000 patients across Vietnam, and nearly 100 of them have received surgery. Among them, 10 were treated for genital reconstruction. Many of the patients were fully sponsored and received free food, accommodation, transportation, and medicine. At the hospitals, assistance for the families was provided by 10 student volunteers.
Sau khi mà được tham gia cùng với các bạn đến bệnh viện để giúp đỡ các em nhỏ khám chữa bệnh thì em mới hiểu được cái nỗi đau với cả sự mặc cảm của các em bé mà bị như thế. Em có nghe một chị bế con đến thì chị nói là kiểu em bé khi mà mới bắt đầu đi học thì kêu ở lúc mà các bạn ở trong lớp mà đang thay đồng phục ấy, thì với tất cả các bạn bình thường thì đều được nên thay hết, nhưng mà riêng em sẽ chui xuống gầm bàn thì em thay, bởi vì là em ý thấy được cái sự khác biệt của cơ thể em ý với cả các bạn cùng lứa với mình.
To date, the program has invited Dr. De Castro to perform surgery in Vietnam 5 times. Among the patients that Dr. De Castro has personally operated on, Greg Kraft was most impressed by a poor young man. He had his penis mauled by a dog after his parents left him at home alone when he was just 4 months old.
It's very heartwarming. I mean, it's sad to imagine that somebody for 20 years lived in a living hell, as he called it. But now, when you see him, he's one of the happiest people you could ever imagine meeting. And he has the chance later of becoming a completely normal man. One person out 20 years, what it's done to them, and knowing that we've changed his life is just, it doesn't get any better than that.
Kraft revealed that it is exactly these stories that motivate him and his wife, as well as Mai Anh and the other members of the program, to continue raising funds to help unfortunate children.
It's our honor today to have Thiện Nhân adopted mother Trần Mai Anh and his godfather Greg Kraft on to talk more about Thiện Nhân Journey program and their efforts to help other kids with similar plight. Hi, welcome to the show. Chị Mai Anh, do đâu mà chị biết đến bác sĩ De Castro?
Tôi cùng với bé Thiện Nhân, với cả cha đỡ đầu của bé, cha nuôi của bé, ông Greg Kraft, đã đi rất là nhiều nước trên thế giới trong nhiều năm để tìm kiếm làm sao cho bé Thiện Nhân trở thành được người bình thường. Và chúng tôi đã đến Mỹ. Tại Mỹ chúng tôi gặp được bác sĩ Việt Kiều, một bác sĩ rất nổi tiếng về Việt Nam là bác Tuệ Đinh. Và bác đã theo dõi cái trường hợp của bé Nhân, và cũng chính nhờ bác tìm kiếm và theo dõi thì với một ngày mới gửi cho Greg Kraft và tôi 2 cái bài nghiên cứu khoa học của bác sĩ De Castro từ một nơi nào rất xa xôi về cái việc tái tạo, phương pháp tái tạo bộ phận sinh dục cho bé trai và bé gái. Và từ 2 cái bài báo đấy và chúng tôi đã tìm kiếm bác sĩ Roberto và tìm đến với ông.
Chị có thể nói gì về ý nghĩa của những ca phẫu thuật mà bác sĩ Roberto De Castro đã tiến hành cho Thiện Nhân không ạ?
Nếu mà nói ý nghĩa thì vô cùng. Ca mổ này mang đến cho Thiện Nhân cơ hội tưởng chừng như rất đơn giản với tất cả mọi người, đấy là trở thành một người bình thường. Và em bé tự tin đi học. Một điều rất đơn giản, tự tin đi học, tự tin đến trường như các bạn. Và một cái điều tự tin mà nói thì có vẻ mọi người thấy không cần thiết, nhưng đối rất cần thiết, đấy là việc mà tự tin đến trường và đi vào nhà vệ sinh đúng giờ ra chơi như tất cả các bạn khác. Và cái đấy đã mang cho thằng bé cái sự một cuộc sống bình thường, và cái sự tự tin đấy nó sẽ ảnh hưởng, tôi tin chắc rằng nó sẽ ảnh hưởng rất nhiều đến cái cuộc sống sau này của em bé.
Vâng. Chị có thể nói cho em cái điều lớn nhất mà bác sĩ De Castro đã làm được cho Thiện Nhân và các bé nhỏ khác?
Bác sĩ De Castro đã làm được cái điều không phải là quan trọng nữa, mà một điều dường như là đúng thực là không thể. Một điều không thể và quá tuyệt diệu. Nếu như mà ai có thể nhìn thấy những người cha, người mẹ bế con, dắt con đi khám, đi gặp bác sĩ để khám. Những người cha dắt những đứa con gái nhỏ vừa đi vừa khóc. Rồi họ hy vọng sau ca mổ, rồi những người ông, người bà vui vì thấy con và cháu mình còn được tiếp tục những thế hệ tiếp sau nữa, thì cái điều đấy không thể nào một cái ngôn ngữ hoặc là một cái gì của cuộc đời bình thường có thể diễn tả nổi.
Greg, I'll continue with you. It seems to be that with Dr. De Castro, you've been with him every time there has been a surgery. And what can you say about Dr. De Castro's devotion to the Thiện Nhân journey?
I think the most striking to me is from the first time that we were in Bologna together. He didn't just complete the operation and then, say adios, I hope things work out. He was with us and with Thiện Nhân, night and day. And I think, again, it comes back to my characterization of him as a very warm and compassionate human being. But even when we decided to start the surgeries here, it's really sort of a funny story. After the decision was made that Dr. De Castro would fly here to carry out some corrective work on Thiện Nhân, word started to leak out that this famous doctor was coming. And so we would conversations say, we've got 2 or 3 other kids. Would you mind taking a look at these kids when you come? And he, no, of course not. And it grew, and it grew, and it grew, to the point that it was about 4 months later when he came on the first mission to Hanoi to look at several kids. It turned out there were 120 of them.
Wow.
And I think this also had a big impression on certainly on Mai Anh and I and Dr. De Castro, from the standpoint that we realized that culturally this isn't something that most people are comfortable talking about.
Yeah.
Their children having a genital problem.
It is a taboo
Exactly.
subject. Yeah.
And whether it was as severe as Tien Yun, having a traumatic injury like that, we felt like a bubble had burst, and people, poor people, even wealthy people, were coming out of the woods, so to speak, to ask for help. So that's another, I think, milestone moment that Dr. De Castro certainly didn't shrug away from, and we see that he's now been back here 3 other times.
Yes. It's good to have you.
Born without genitals or an anus, 6-year-old Nguyễn Văn Thanh Sơn from Thanh Hóa province has undergone 2 unsuccessful surgical procedures. Every day, he has to carry a chamber pot with him wherever he goes, because liquid is always leaking out. This is the 3rd time that his father, Nguyễn Văn Du, has taken him to be examined by the Genital Reconstruction for Children program. Luckily this time, his son is finally eligible for a surgery.
Cháu biết là lần này cháu được đi ngủ để sớm được theo học, cháu mừng lắm. Và cháu vui, cháu đang ngồi trên bồn ôm chầm lên cổ bố là vậy là con sắp được đi học rồi, bố con sắp có cu rồi. Cháu bảo như thế.
The procedure took nearly 3 hours, and Thanh Sơn father nearly exploded with happiness.
Mổ xong thì bác sĩ vô cái châu bác sĩ Việt Nam mình đã nói là ca mổ của cháu là tương đối thành công, và là ca mổ mà làm cho ông Gilberto là cảm thấy hài lòng, và ông kết hợp cho cháu cũng được 2-3 giai đoạn để rút ngắn cái thời gian cũng như là phẫu thuật nhiều lần, thì ông nó rút ngắn lại. Thì tâm trạng của em, gia đình của em, cái tâm trạng hiện tại của em bây giờ là em rất vui. Có thể là tiền bạc cũng không thể mua được, mà cũng không có gì làm cho em vui hơn lúc này được.
Also 6 years old, Triệu Đức Tuy from Xuân Long commune in the northern mountainous province of Yên Bái has undergone genital reconstruction surgery performed by Dr. De Castro. The operation took place in November 2011. It was a miracle for the boy and freed him from the pains that he had suffered since birth.
Con người ta sinh ra, sinh con trai thì người ta phải đi vệ sinh, đi tiểu, người ta đứng, con mình thì bảo con trai thì phải ngồi đái, mình cũng cảm thấy có mặc cảm tủi thân cho con.
Tuy has hypospadias, a rare birth defect that involves an abnormally placed urinary opening. His family is poor, so spending thousands of dollars to have him treated at the National Pediatrics Hospital was just a dream. But then, by chance, Tuy's parents learned of the Genital Reconstruction for Children program. In August 2011, Đức Tuy was examined, and only 3 months later, he underwent surgery. Dr. De Castro performed the 6-hour surgery, which was a success, much to the delight of the family.
Đứa cháu tôi sinh ra thì tôi cũng ở Hồ về hỏi bà cháu dai cháu gái. Thế mà cháu dai là 2 cái đường tiểu này thì lúc ấy tôi rất buồn. Hiện nay được cứu chữa thì tôi thấy phấn khởi. Rất cảm ơn các bác sĩ, các nhà y học giúp đỡ cho gia đình tôi.
Sơn and Tuy are just 2 of nearly 100 Vietnamese children who have been operated on by Dr. De Castro. His technique of phalloplasty using flaps and blood vessels can restore the senses in the penis. Notably, the reconstructed genitals can grow with the rest of the body. The price of this form of surgery in Europe and the US is between $80,000 and $100,000 US. However, thanks to the support from hospitals and doctors, the surgery in Vietnam costs only $2,000 US.
Dr. Roberto, can you tell me, what do you think is the biggest thing you've been able to do for Thiện Nhân and other little patients?
Well, when I had the opportunity to start thinking about these problems, it was about 15 years ago, not so long ago. At that time, the people thought, that surgeon, the doctor, thought that it was impossible to make a penis at that age. So the possibility are 2. Wait for puberty, wait for adult age to have a phalloplastic, to have a reconstruction of the penis, or make a big mistake, change sex, reassign a female gender in a boy. That is a boy in the brain, that is a male in the brain. So that's generate, particularly in the Western world, North America and Europe, they generate tragedies and tragedies. So I had the opportunity working particularly in the Arab world and then around the world, to meet many of these boys, and even very, very young. And so we started thinking about the possibility to give them, you know, the possibility to have a looking penis, a good-looking, possibly penis. Sometimes even a functional one, but the majority is more just a cosmetical, not working like a penis, but have the appearance of the penis. But some of them, and I'm very happy to say that Tiannan is one of them, can have also a reconstruction that we call functional, because we made for them the possibility to, you know, to have a functional penis. That means having an erection in the future and work like a normal 100%.
Greg, can you brief us about what the program has done so far?
Well, of course, you know, the obvious was Tianyan, which has been a 6-year journey. Now, hopefully with a happy ending. I think out of all of the patients that we are evaluating and have already performed surgery on, the idea is to continue that, obviously, because there is a lot of aftercare to be undertaken. I think the other issue, though, is, for lack of a better word, training. Because one of the things that I think so many people admire about Dr. De Castro is even when he first came to Vietnam, his second mission, he insisted that we try to organize, his first mission, that we try to organize a training workshop so that he could begin to train, not train, but also teach Vietnamese surgeons his new technology, which, you know, is so important. You know, Vietnamese surgeons are extremely good. I mean, they're some of the best in the region. As a matter of fact, one of Vietnam's first liver transplants was just completed at the National Pediatric Hospital. As far as immediate steps, it's important to note all of us work basically as volunteers. Dr. De Castro and his colleagues who have come, there's no charge. Nevertheless, you know, there are expenses associated with these things, airplane tickets, hotels, moving 120 families. Actually, as Dr. De Castro pointed out, probably 400 families now, moving them around throughout Vietnam, coming up here, putting them in hotels. A lot of the medical equipment and parts that are used are very specialized and extremely expensive. But it's interesting, for the past 4 missions, we've been able to achieve all 4 at approximately the cost of what it took us to go to Italy for one surgery.
Wow.
And to be able to impact so many families and young people, that's what gave us sort of this idea to take it forward. It's a surgery that won't be seen, but it profoundly changes these young children's lives. So we hope to keep growing this. Dr. De Castro has committed that he wants to stay involved with this for as long as he can, and I think all of us also are going to continue our effort to make this happen.
That's fantastic.
Following a long day in the operation theater, Dr. De Castro walks back to his hotel. After staying there for 2 weeks, he knows a shortcut through a small alley near the hospital. Every morning he walks to the hospital to examine patients and perform surgery. When he comes back in the afternoon, he goes straight to his laptop to write up his notes on each case.
It's very, very important not to forget anything about the patient. All my life I was thinking that it was very important for all my patients, not only here but everywhere, to be so precise in the file, to make a nice file. So in the future, when you see the patient, you can very well understand what was done and what the patient needs, and you don't have to come back and repeat all the questions to the family.
No days off, no sightseeing, just pure devotion to his child patients, sometimes performing operations that can last up to 10 hours. Dr. De Castro says he wants to volunteer to come to Vietnam twice a year to perform medical examinations and surgeries on child patients for 3 weeks at a time, and he doesn't want any remuneration. He also once said to the Vietnamese press, I'm sorry that I've come with just these 2 hands. I try my best to keep the price of surgery in Vietnam at a fraction of the price of similar procedures in Europe and the US. I hope that people across Vietnam will join hands to give the little patients a ticket to adulthood.
So far, how many children have you offered to help, and in what way?
We want to help anyone who walks in the door. And I now say to people, you know, it's like a lottery. If one of these kids manages to come in and we see them, we have really not turned away anyone yet.
Wow.
But I think most logically is, of course, Dr. DeCastro's high experience that he can judge really who is going to be a good candidate for the program.
Can you tell me about the biggest challenges that you have faced so far?
Well, I have to be honest, that would be funding. Because there are many, many noble causes out there. I think from a medical standpoint, it's just the reality. Institutions, the medical community, governments, they need to put most of their the available funding into programs that are going to benefit millions of people. Malaria, dengue fever, typical childhood diseases. And so that makes it even a bigger challenge. I don't think, there's not anybody when they hear about this or hear the magic that Dr. DeCastro performs is not impressed by it. But the fact of the matter is there's just not much public awareness of it anywhere. And there's also very little funding available. So I think part of the beauty of trying to do this in Vietnam, which is is still a developing nation, is that this is going to become the state-of-the-art place that I think other surgeons and other families from throughout the region will be able to come to. And I'm very confident that we will be able to raise that money, but it's not easy. So that's probably the biggest challenge.
So hopefully today on Talk Vietnam we can spread this out to more people.
I hope so. And in fact, it's worth pointing out, in the West, these typical operations regarding genital surgery can be $50,000 to $100,000 US or more. And if you amortize what we've been doing at each mission, we're doing it now for probably $2,000 or $3,000 a child.
Wow.
So it's really, in terms of an investment in this new field, there's a pretty big bang for the buck. So we do hope that people will see their way to want to help these children, as many people do for my example of Operation Smile.
Chị Mai Anh, em sẽ muốn hỏi thêm một câu với chị nữa là chị có thể kể cho em một chút về sự hưởng ứng hoặc là giúp đỡ của cộng đồng không? Có nghĩa là cái funding mà mình vừa nói đến.
Có một điểm đặc biệt của những cái đóng góp đấy, có lẽ cũng bắt nguồn từ những cái đóng góp đối với bé thiện nhân. Đấy là của những cái sự quan tâm của các con người với các con người với nhau. Và cái sự đóng góp đấy rất đặc biệt của việc nó từ những con số 50.000, 20.000 cộng dồn lên để có gần đấy ca phẫu thuật thì phải hình dung đó là hàng trăm, vài trăm hoặc hàng nghìn cái sự đóng góp của các cá nhân khác nhau đã đến với chương trình Góp Gió Để Thành Bão.
Vâng, chị có thể kể cho em một câu chuyện nào đến cảm động về tấm lòng hảo tâm không?
Một câu chuyện cảm động. Trong các câu chuyện cảm động, một ngày chuông cửa của nhà tôi kêu và có một người đàn ông trong bộ dạng sau ca làm về rất là lem luốc đến xin đóng góp 50.000 và chắc chắn công việc của anh ấy rất là vất vả, và 50.000 đấy đối với mỗi người của chúng ta có thể là một phần của một ngày đi chợ, nhưng với người đó thì có thể là nhiều bữa ăn, và vẫn tự nguyện đóng góp cho chương trình để với mong muốn là góp một hạt cát nhỏ để giúp nhiều những cái em bé khác. Cái sự chia sẻ đấy rất đáng quý và thực sự là chúng tôi rất xúc động. Chúng tôi vừa muốn nhận số tiền đấy, vừa muốn không. Nhưng trách nhiệm của mình là nhận, nhưng nhận rất là chịu lòng và cũng rất là mong nhận được nhiều những sự chia sẻ, khởi nguồn từ những cái sự chia sẻ khi mà bản thân người nhận cũng rất là chịu lòng như vậy. Và cũng từ đấy thì mới có nhiều những ca mổ mà chúng tôi đã làm trong thời gian vừa qua.
You know, a similar story, the one that always sticks with me was a young man who his genitals had been eaten when he was very young, and his father, who was a veteran and very sick and in a wheelchair, came to us and offered very seriously that the child was a little bit older. He was a teenager by this point, so a whole lifetime without genitals. And this war veteran, Vietnamese war veteran, came to us and said that he wanted to donate his penis and genitals to his son. Now, you know, obviously that was not medically possible or feasible, but the thought of that, you know, a parent would give up such an important part of his life for the benefit of his child was extremely touching to me, and I think all three of us have never forgotten that story.
Yeah, it sort of shows this love that has no borders.
Right.
Yeah, that's an amazing story. Thank you for sharing that. Chị Mai Anh ơi, em xin phép hỏi chị thêm một câu nữa. Một gia đình mà muốn được chương trình hành trình thiện nhân giúp đỡ cho con mình thì sẽ phải bắt đầu từ đâu nào?
Nếu như mà các cháu bé bị những cái hoàn cảnh tương tự, khiếm khuyết bộ phận sinh dục, thì có thể gửi thư đến chương trình rất là đơn giản, ghi rõ cái hoàn cảnh bị thương do bẩm sinh hoặc do tai nạn, thời điểm và những lần chữa trị, kèm theo hình ảnh chụp của những vết thương và tất cả những cái hồ sơ bệnh án từ trước đến nay nếu như có. Và nếu như những cái bệnh nhân đấy nằm trong cái lĩnh vực bệnh mà chương trình đang quan tâm, đang chăm sóc và chuyên môn của bác sĩ Roberto cũng như các bác sĩ tình nguyện của chương trình, thì chúng tôi đều đặt lịch hẹn cho các cháu đến. Những cái gia đình muốn giúp thì làm đơn và gửi về địa chỉ chương trình tái tạo bộ phận sinh dục cho các bé, 12B Ngọc Khánh, Ba Đình, Hà Nội.
Well, thank you so much, Mai Anh and Greg Kraft, for joining us and for what you've done for the kids. I think I'm not the only one here appreciating the great work that you have done. And thank you for your time today. We wish you all the best of luck in your future journeys, and I hope you will be able to spread out more and more help, and more people will take part in participating to help other kids as well.
Thank you very much.
Thank you. Can you tell me a little bit more about the surgical method that you've invented?
My technique is a spirit of another technique of phalloplastic that was introduced by Mr. Prior, that is an English surgeon. And he suggests to create a penis and to create the urethra using a flap from abdominal wall. Apparently, this procedure was not successful in the adult life very much. Probably because they pretended at the same time to make the penis very long and the urethra as well.
Yeah.
I thought that we can use the flap only to create the penis, and maybe we can do the urethra. We can create the urethra, so the conduit for the urine and the sperm to go out, with some in different way. So I thought it was possible to use a tube of bladder mucosa, or a tube of cheek mucosa, or of labial mucosa, or a combination of this, and to insert inside of the flap, and then make a penis and the urethra at the same time. Then I realized it was not safe to do that. Better to do the penis first time, and then maybe wait for some more steps to do the urethra. And so I starting to develop this, and every child I did in the beginning of my experience make a little difference, because then we realized that we need something inside to have you know, the penis stay in the right position, not move too much. So we use some muscle from the abdominal wall that they are incorporated in the flap. So this is what the development. Now we reached the 32 phalloplasties was done already. And the majority in Vietnam, because we did 5 in Vietnam. So it's a big number. If you consider that in Italy we did only 3 or 4 in Italy, and the rest around Europe, United States, South America, and Middle East, and Far East as well.
What are the prospects or advantages of widely applying this new surgical technique in Vietnam?
Luckily, this tragic problem, are very rare. If you think about congenital absence of the penis, this is 1 case every 20-25 million birds. So you mean in a population like Vietnam, probably we already finished all the cases, because talking about congenital, because it's a very rare situation. But we have the traumatic, but we have the what we call iatrogenic. That means people that was born with a normal situation, but they receive some very bad operation, like the simple circumcision. Sometimes even the simple circumcision can you know, destroy completely the penis if you do really in a bad way. So there is many other situations in which my technique can be applied, and so I hope that particularly at the moment the doctor for the National Pediatric Hospital in Hanoi, that very good, and they were with me all the time during my missions, and they are ready now. They are ready to do the surgery together with me and without me. So I hope my technique will be helpful for many more patients.
What can you say about the rate of success of you know, all the surgeries up to now?
Psychological point of view, 100%. The improvement is fantastic. A cosmetical point of view, I have the exact number because we review recently all the cases. I can say that we have 70% acceptable result, good or good after revision. Cosmetical point of view, not too bad. And functional point of view, I have only few patients that I can say we did a functional reconstruction. They have a normal penis, they can void, they can have erection, they can have everything. I have some of them, but are very few.
Excellent. Have any of your patients talked to you about their sexual lives? Have they said you have helped them with that, or no?
For the time being, no.
Not yet. They're too young.
Yeah, too early for that. I hope to answer this question that is, for me, is one of the most important questions. Very soon, to have the answer. For the moment, it's just a dream, it's just a hope for their future.
Okay. Thank you so much for joining us on the show today and sharing your stories, as well as helping Thiên Nhân and other patients.
Thank you.
I hope to see you again sometime soon.
Thank you.
Hopefully learning more about your patients.
I hope so. Thank you very much.
Thank you so much. And it's time for us to say goodbye now. I hope you enjoyed the show as much as I did. I'm Ola Ding. Let's talk Vietnam again next time. Goodbye for now.